Guys, so I'm here with one of my longtime clients, Dawne here, Dr. Dawne. She's a chiropractor. Yeah, she's been fixing me up these last 2 years. I've been training her, and I've had a weird string of injuries, right?
Yeah.
But over these last 6 months have been pretty injury-free, been pretty pain-free. So yeah, I'd love to get your insight on a couple of things here to help my clients here. Usually the people I train, they just want to be healthy, strong, lift heavy weights. What are some ways to reduce the risk of injury?
That's a great question. I think there's many ways to answer that question, but I think the simplest way to put it and the best thing that I've noticed in my time of helping people is don't do too much of one thing. You have to explore all ranges as a human. So I'm going to use like a CrossFitter, for example. Anytime somebody comes in as a CrossFit athlete, typically the movements that they do in that sport are within this plane of motion here. And so a lot of their aches and pains go away when we start to explore other ranges of motion. So I think that's what's typically missing, is that people are just lacking exploring certain directions. So that's the easiest answer that I got.
For sure, absolutely. Like one of my clients actually he had a shoulder injury, right? However, it was only when he was bench pressing, like tapping his chest, right? So what we did, we just went about halfway here up until that pain where he feels pain. Then we'll just kind of stop there and just explore that range of motion. And so far, that was like pretty pain-free for him.
Absolutely. That's the thing too. That's actually a great segue, is like pain itself should not be something that stops you from doing what you love. There are many, many, many ways to modify an exercise. Do the exact same movement, don't go as low until it feels better. And then maybe you can get that depth back again. That's a great example.
Absolutely. Even though for my rotator cuff strain, right, like at first I was hitting such a good stride with the training, then all of a sudden I got this like freak injury from doing a pull-up, loading it up too heavy, too fast. It was my first day trying it. I haven't trained in a while, so I just decided to switch that movement, and I strained my rotator cuff on like that last rep. And one thing that really like resonated with me and that stuck with me, you said, was use pain as a guide, right? So the only thing I couldn't do was the pull-up motion, right? But everything else, bench presses felt fine, incline press, shoulder press, everything felt fine, wide grip rows. The only thing that I couldn't do was the pull-up. So I just stayed away from it and still continued to progress my training, and it was awesome.
I think you were still able to do like lat pull-downs.
Yeah,
so you're getting the same motion and you're just changing the resistance a little differently.
Yeah. So I'm sure you get this question all the time here, Dawn, but hey, what do I do to stay pain-free forever? Things like that, right?
Absolutely. I think I try to be as honest as possible when I'm working with people, and I think the number one predictor of injury is past injury. So for us to say that you're going to have a completely pain-free life means that you're probably dead, because pain is there to be something that just keeps you safe, keeps you alive. It's all about survival. So again, don't let pain prevent you from doing the things that you love. It's always just finding ways to manage it, to know a little bit more about your body, things that you can't do, things that you can do. The things that are green lights for you, load it, have fun. The things that feel like they're limited, that they're always causing you pain, learn a little bit more about that. What is it about my body that seems to not like this specific movement, and in what ways can I start to push that threshold for my body? So my goal when I work with people is, let's build a toolbox for you, and now you know what tools to pull out in the future when this pain comes back, because ultimately it's probably going to, but it shouldn't last as long, shouldn't be as frequent, shouldn't be as intense.
Yeah, no, that's good stuff, right? Like kind of back using pain as a guide, right? Like during a training session, you may feel aches and pains throughout the month, but other variables like rest and recovery, super important as well. So,
absolutely.
For sure. A great way to like reduce risk of injuries is a proper warm-up, right? Priming the tissue. What do you think of that, Dawn?
Totally, I agree. I think that there's a lot of amazing personal trainers out there, Ryan included. But the thing that I see as a common pattern is the warm-up routine at these gyms is just, it could be better. It really could. Dynamic stretching is wonderful. Having separate sessions for your static stretching is great too. As well as just like lower intensity of the movement you're about to do is great too. But when it comes to like injuries or rehab, which is obviously my specialty, priming the tissue properly or offloading the one that is painful is kind of what's missing. So, things like really getting the butt cheeks to feel fatigued before we go and do like squat patterns or deadlift patterns. Feeling like you're creating great mind connection to the stability of the core before you go and do those motions. Those are things that I see lack a lot before we work out, so I think that could be changed.
It's like it all starts with your brain, right? Your nervous system. You want to learn these movement patterns before you start loading them like crazy. Even pain itself too. That's a brain response at the end of the day, right? So
Well said.
yeah.
So, based on that, I think Ryan wants to show a couple of warm-up exercises that he has seen has worked really well for his patients.
Yeah, absolutely.
For his clients.
Yeah, there you, I get it right.
Let's show it.
Yeah, let's dive into it. Foundation of my training is built around the heavy press-in, the heavy chin-ups and such. I had this weird string of shoulder injuries and elbow strains. Nothing super serious, but one thing I found that's really relieved the pain was the Passover exercise you gave me, right? It's been a staple of my warm-ups and priming my tissue for my warm-ups now, so it's been a really great one. I've also had a client, she had some like radiating pain coming down here, and working the Passover, exploring different ranges has really helped her a ton as well, right? So for her lat pull down, we had to kind of stop it here. If she got too high up, that's when she would find like pain, right? So we'd only explore that range for her right there. So,
okay. And you said that doing the Passover part, you got back to maybe doing full range afterwards?
Yep.
How long did that take?
A session.
Pretty quickly, right?
Really quickly, yeah.
A lot of times it can be that quick. Not all the time, but it can be.
Okay, so ways that I teach this exercise, a lot of times it is taught slightly differently depending upon what I'm seeing from the patient, what we're trying to accomplish, as well as just, maybe the cue's not working, I gotta throw another one at them until you see what you want. But here's the basics of it. Go ahead and bring your feet and knees up to the ceiling. Here we go. So you want about 90 degrees here, okay? I want your feet close and let your knees open up as wide as the shoulders. Perfect. Maybe rotate those feet in a little bit more. There you go. And then I want you to go hands on belly, right? Actually, right where you're at. Just show me a couple breaths into the belly there. And this here, typically, depending upon the person, is the hardest part, is just learning how to properly belly breathe, okay? But let's just say that everybody's doing it really, really well. I'm gonna take those hands away from you. You're gonna reach up to the ceiling. Perfect. So what I'm looking for is position as well as where are they breathing. So position being, a lot of times when people are on their back like this, their ribs in the front here will stick up to the ceiling. So I'll say hide your rib boobs. There you go, you're a little more active through there, right? Yep. Now take a big old deep breath into the belly button to push it to the ceiling without losing that. And then the second part would be I take my fingers to the outer areas, kind of oblique areas here. See if they can push my fingers out with their breath, which Ryan's doing a really good job. That usually is the hardest part, and sometimes I just have to have people practice this for a little while. So now that we've found proper stability in this position, can we keep it through movement? So you're gonna breathe deep into the belly and reach backwards. You'll let the breath out when you return. Good, and I'm keeping my eye on those ribs right there. I'm not against rib movement, but particularly for this exercise, I just don't want it to happen. Good, one more breath. Breathe deep into the floor as you reach. And take a little break. So this exercise here, there's a lot of different things that are happening. Go ahead and relax. The basis of it is core stability, building proper intra-abdominal pressure, diaphragmatic breathing, breathing deep down into the pelvic floor, learning how to create a stable base for movement. This movement can easily transfer into squatting, deadlifting, any functional movement. It's hard though. Once we get up off the floor, it's different for sure. If we can control that stable core, reaching overhead, now we're exploring mobility of the shoulders, mobility of the T-spine, so it's a great one. I've had a lot of people with shoulder injuries and neck injuries. This works really, really well in reducing discomfort. I'll even do this for people with low back issues. Those ones that in a barbell back squat or deadlifting, they like to stabilize here, that big old extended back, working through proper intra-abdominal pressure instead and finding that in the barbell movement works great.
I'm getting better at it, huh,
Dawn? Yeah.
I could really get over here. I'm getting all the way down.
Yeah,
well.
definitely.
So.
And I think that Ryan wanted me to teach just one more exercise. He calls it the hip hinge. I call it the low diagonal sit. And so I'll just have you kind of rotate onto one side, face the camera. Perfect. So purpose of this one, what we're doing is we are definitely stretching posterior capsule of the hip. So kind of the glute tendon muscles that wrap around that backside of the hip here. You're going to feel a lot of that activating. We are also exploring internal rotation of the hip, adduction of the hip, just certain areas of the hip that not a lot of people explore, for sure, especially if we're only working in sagittal plane motions. So we're going to set up like we're doing a little side plank here. Good. Actually, come on down first. Don't come all the way up. Good. Just bring your knees towards your chest. Good. Drop this back leg backwards. There we go. And then you're going to want to make sure that your elbow's right under your shoulder there. Perfect. And then take this one just to your hip here. Beautiful. So Ryan's already doing a good job, but most of us at home, if we're doing this, we're probably gonna sink to the floor. So go ahead and show them what that looks like. Nice and lazy in that position, we don't want that. So I'll say, little campfire got built under you here. Stay away from it. Don't let the flames touch you. Perfect. And now where his hand is, we're gonna pretend there's a flashlight here. Can we shine that flashlight towards that hip? Good, and Ryan's actually doing exactly what we don't want. The flashlight is not on your shoulder. Okay, so come on back. Flashlight is right here on your hip, so only go as far as the hip will let you. Boom, breathe into that, okay? If we can get you there, then I want you to squish. Beautiful. And if that feels okay, push so much through that knee you can pop up a little bit. There you go. Good, let the audience continue to see your Superman logo here. Beautiful. And control it down. Awesome job. It's pretty intense when you get it done properly. Where do you feel this at?
My glute for sure.
Glute area is pretty much ideally what we're looking for. Anywhere on the side body that's down is what we're looking for. So one more time, don't let the flames touch you. Shine your flashlight only through the hip, and then we lift. Good. Let the audience see your Superman logo. There you go. Superman or Batman, Ryan?
Batman.
All right, Batman logo then. And then relax. Awesome job. So he asked me, when do I give this to a patient? I give it to a patient basically when a lot of times in squat patterns, I see them shift to one side, bias one side. I'll have them do this on the opposite side and it'll help them shift back. Happens or works a lot, really great with low back issues, groin issues, things of that sort.
Do you refer this to sciatica patients as well?
It can be, yeah. It might be, it just really depends. How bad is it? Maybe right off the bat, we don't want to go right into this because it can put a lot of tension on that nerve that maybe is already pissed off. But I've definitely seen if sciatic nerve's on the right, but they're sitting into that right hip a lot, let's do the opposite side and pain might get better.
For sure, yeah. I think one of my I had some recurring sciatica and you gave me this one. It's
Oh
pretty
yeah,
good too. So
we did on the opposite side
Yeah.
of your sciatica too.
it helped. So.
Guys, so I think purpose of this video was just to kind of talk about, again, don't let pain deter you from doing what you love. There's many, many ways to modify exercises so that you can stay exploring what's going on, exploring your sport, stay active. And then, Ryan thought it was really important to show some of these really great exercises to build into your warm-up routine to properly prime tissues. Maybe it'll help you decrease some discomfort as well. If you have any personal training questions, strength training questions, he's definitely your guy. I've been training with him for a year now, and he's wonderful at what he does. If you guys have any injury questions, pain questions, you're always welcome to reach out to me. I'm at Performance Place Sports Care. We'll talk to you guys soon.
Thank you guys. Appreciate you.